Konnichiwa. Welcome to the September Journal of Arthroscopy from Kamogawa, Japan. My name is Hiroshi Ohuchi and I'm one of the current associate editors. This issue contains 13 original articles, 1 meta-analysis, 4 systematic reviews, and an editorial. Please let me introduce some of the articles that may be of interest to you. Lee et al. Performed a meta-analysis of randomized controlled trials, critically dealing with the efficacy of concomitant platelet concentrates used in arthroscopic rotator cuff repair. In this study, 7 randomized controlled trials were identified, comprising 451 patients who had been treated by arthroscopic rotator cuff repair, and the re-tear rates and constant UCLA, SST, and ASES scores showed no significant differences between arthroscopic rotator cuff repairs with or without platelet concentrates. Mascarenhas et al. Performed a systematic review focusing on whether double-row rotator cuff repair was clinically superior to single-row repair. After application of the YADAD algorithm, 3 concordant high-quality meta-analyses were selected, and these 3 all found significantly better structural healing with double-row compared with single-row rotator cuff repair. Park et al. Compared the acromion morphology after single-row repair with a minimum of 4 knots and suture bridge type repair with minimal knots in medium to large rotator cuff tears. Their hypothesis was that protruding knots in single-row repair would cause more acromion erosion due to impingement than the suture bridge type repair, which is low profile. They concluded that there was no difference in acromion erosion in high-profile knots made by a single row compared with double-row suture bridge low-profile repairs. Werner et al. Studied the incidence of postoperative stiffness after open and arthroscopic biceps tenodesis and determined relevant risk factors for its occurrence. They reported that there was an increased incidence of postoperative stiffness after arthroscopic suprapectoral biceps tenodesis compared with open subpectoral biceps tenodesis, and that stiffness occurs more commonly in females and smokers. They also reported that this complication most commonly improved over time with symptom-based management. Gatt et al. Performed a systematic review to assess the outcomes and complications of ultrasound-guided barbotage for calcific tendinitis of the shoulder. 13 articles with a total of 905 patients were analyzed, and in all the papers reviewed, authors reported a good clinical outcome, with many achieving marked improvement in clinical scores or overall satisfaction with the treatment. They concluded that ultrasound-guided barbotage is a safe technique with a high success rate and low complication rate, although there is no evidence assessing its effectiveness as compared to other major treatment modalities. Keller et al. Compared the accuracy of tibial tunnel placement during ACL reconstruction using independent femoral and transtibial techniques. Independent femoral drilling was associated with the placement of a higher percentage of tunnel aperture within the native tibial footprint. However, there was no significant difference between the 2 techniques in placing the tunnel aperture near the center of the footprint or in graft obliquity. Famir et al. Performed their study to determine whether ACL features on MRI and knee laxity are improved 2 years after ACL rupture treated non-operatively. Fiber continuity improved in 60% of patients, and the empty intercondylar notch resolved in 44%. 32% improved on the Lockman test, and 8% improved on the pivot shift test. In conclusion, they reported that in 2 years following ACL rupture and non-operative management, patients experienced partial recovery on MRI and some knee laxity improvement. Also, improvement of ACL features on MRI correlated moderately with improved laxity. Wang et al. Discussed the CRP and ESR changes following ACL reconstruction as a guideline to diagnose and monitor postoperative infection. The threshold values of 41 mg per liter of CRP and 32 mm per hour of ESR had the most optimal sensitivity and specificity in determining a normal or septic joint. They also reported that CRP was more useful than ESR to evaluate the infection's response to treatment. And finally, I would like to advise our readers to be sure and watch some of the great videos at www.arthroscopytechniques.org, as our editor-in-chief, Dr. Lubowitz, urges us to do in the editorial. Please enjoy reading the September issue.